Bismillah ar-Rahman ar-Rahim. Hypercalcemia in lung cancer. Definition and etiology. A serum calcium level over 2.75 millimole per liter is considered abnormal. Borderline values need repeating. And in malignancy, a raised calcium is due to increased osteoclast activity, either from bony metastasis or the production of parathyroid hormone related protein. A serum level of more than 3.25 millimole per liter is rare outside malignancy, although can occur in sarcoidosis. The clinical features: values over 3 millimole per liter are usually symptomatic. Common symptoms are confusion, weakness, nausea, reduced fluid intake, and constipation. There may be a short QT interval on ECG and maybe also renal failure. Investigations exclude other causes of hypercalcemia and identify the tumor, although in most patients with malignant hypercalcemia, the diagnosis of malignancy will already be known. The parathyroid hormone will be suppressed in malignant hypercalcemia but raised in hyperparathyroidism. The phosphate will tend to be low in hyperparathyroidism and hypercalcemia due to ectopic parathyroid hormone, and the normal or high in sarcoidosis, metastatic bone disease, and with excess vitamin D. Renal function tests for checking for renal failure is important. The management of hypercalcemia includes isotonic saline infusion 250 ml per hour initially to reverse dehydration but avoid fluid overload, and reducing to 150 ml per hour plus or minus furosemide to increase calcium excretion. Steroids help, but less so than in sarcoid-associated hypercalcemia, partially through reduced intestinal absorption. In addition to this initial management, reduced bone resorption and with reduced bone reabsorption with biphosphonates takes a few days for maximum effect. The biphosphonates can also reduce the pain of secondary bony deposits and may reduce pathological fracture rate. IV preparations: disodium pamidronate 15 to 60 mg infused over 2 hours, works for several weeks. Dolidronic acid 4 mg over or more than 15 minutes, repeated monthly if required. Oral preparations such as sodium chlorhydronate in dose of 800 mg tablet BID may be given.